Hi, my name is Laura Flaherty. I am starting my second year in the BSN to DNP program. I am going in the hopes of eventually becoming a nurse practitioner, and I'm focusing on adult primary care. I'm one of the two students in the full-time program right now, so I've been keeping busy. I also work at St. Mary's Hospital on a cardiothoracic and vascular floor, a surgical floor. I've been there for 5 years now this summer. So in thinking of a nursing informatics problem, I tried to think of something um, that I deal with day to day that's kind of um, frustrating. And I talked with our CNS on our floor to try and come up with a problem. And what I thought of was regarding our heart failure patients. We have a lot of these types of patients since we are a cardiac unit. So it's our job as nurses to be able to identify people that either have an acute exacerbation of heart failure or a history of heart failure, which can sometimes be a time-consuming task. It's usually for whatever reason not on their medical problem list. So it takes time, to search through H&Ps, medication lists, labs, echoes, whatever you have available that might kind of alert you to the fact that this patient, has heart failure. And the reason it's so important that we're identifying these people, as everyone probably knows, is to get them, the proper education that they need to keep them out of the hospital, and especially for the Medicare patients, to make sure that we aren't missing anyone with the teaching and that we're doing it properly so that the hospital can be reimbursed. So it's just kind of a time-consuming task that's also really important that I feel like could be improved upon. So my proposed solution, I was just thinking it'd be nice to have something that would just automatically pop up when the patient's admitted, saying, telling the nurse, hey, this patient has a history of heart failure, or they've been admitted for something like it in the past, whatever the case may be, a best practice alert, something like that, or even if the heart failure teaching, like the care plan and that, could automatically go into the chart so that the nurse could go into the education and see, oh, if this patient has heart failure teaching on here, they must have heart failure, I need to do the teaching, and so on. So something like that I just think would be really more efficient for nurses. It would be less time consuming, better for the patients, that we can focus on them and that we can make sure that we're not, missing any patients that way. So that is my problem I thought of and my possible solution. I'm really looking forward to this class. I don't know a ton about nursing informatics, so I feel like I'm going to learn a lot and hopefully be able to incorporate what I learned into my practice. And I'm looking forward to working with everyone. Thank you.